Hello everyone, welcome to TechSharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy. And here, mainly we will be focusing on ipsilateral anatomical term of direction. If you remember, in our last session, we talked about other anatomical terms of direction. From the last couple of sessions, we are discussing the same thing. So you can say this session is in the continuation of the same, where we are going to mainly talk about the ipsilateral type of anatomical term direction. Okay, so how we are going to proceed? Firstly, I'll walk you through the definition. I'll explain you what is ipsilateral term, how it is utilized in clinical examples and medical terminology. Also, I will provide you some information related to the interviews questions and pointers that will help you to remind the concepts during the interviews and exam. Okay. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on what is ipsilateral anatomical term of direction. But prior to that, we have already covered various topics that you should know. Okay, and for that you can also refer the TechSharmit digital course book, which is freely available in the description box. There you will find thousands of sessions, one particular tab for medical coding, where we have all sessions available in Hindi as well as English language. So without any language barrier, you can easily consume the content. Yeah. Okay, so let's get started here. Firstly, we will start with the definition itself, like what is ipsilateral. So ipsilateral means on the same side of the body. Okay, so in simple terms, you can say that when two structures or findings are both located on the same side, both on the right side or both on the left side, then they are described as ipsilateral to each other. Okay, so any body structure, any body part or findings that are located in the same side, okay, either both are on left side or both are on right side. So in that case, we will say that they are ipsilateral to each other. Okay, so conclusion is ipsilateral means same side of the body. Now, what is the origin of this word? How this word came into the picture? So the word ipsilateral comes from the Latin, where ipsi means same and lateral means side. So literally ipsilateral is same side. Similarly, we all have for all terms we learn about the opposite term. So the direct opposite term of ipsilateral is contralateral. Okay, so ipsilateral means same side and contralateral means opposite side. Clear? Now let's see what are the common example through which we can identify what is ipsilateral. Okay, so first sentence says the right kidney and the right ureter are ipsilateral to each other. Why? Because they both are on the right side of the body. That means they are on the same side. So yes, both the right kidney and the right ureter are on the same right side. That's why they are ipsilateral. The left lung and the left arm are ipsilateral. Of course. Why? Because both the left lung and the right and the left arm are on the same left side. That's why they are ipsilateral. Similarly, cerebellar strokes cause ipsilateral coordination problem. Now here, try to understand this thing. We are saying it causes ipsilateral coordination problem. That means a stroke in the right cerebellum causes the right side in coordination. So entire right side, that means same right side faces this in coordination. That's why we call it as cerebellar strokes cause ipsilateral coordination problem. Next is ipsilateral lymph node spread in the breast cancer. So cancer from the right breast has spread to the right axillary lymph nodes. So what one thing you find common here? One common thing is ipsilateral. Okay, that means everywhere using the term ipsilateral, that means the things are on the same side. Clear? Now there are some examples related to medical coding. So in medical coding, ICD-10, CM and CPT, the word ipsilateral appear in many contexts. So ipsilateral lymph node metastasis means a cancer spread to the lymph node on the same side of the primary tumor. Ipsilateral breast tumor recurrence, that means cancer returning in the same breast that was previously treated. So here we are using ipsilateral. Ipsilateral carotid stenosis with amaurosis fugax, narrowing of the carotid artery on the same side as temporary eye blindness. So again, here for all these medical terms you can say that we are using the terminology ipsilateral, which is somewhere denoting the same meaning, that they are on the same side. Okay, next example is ipsilateral pleural effusion, that means fluid in the lung lining on the same side as the underlying lung disease. Okay, so what all information we have discussed, whether in a comparison example or in a ipsilateral related medical terminology, everything is denoting the same side, and to denote that same side we are using the ipsilateral terms or anatomical term of direction. Clear? Now we have learned about this thing, right? So now the question is, like, we have learned so many other things also. So in that situation, how we will recall these topics in exam? So for that, I'll give you one short trick that will help you to remember these concepts for your interviews and exam as well. Okay, so the word ipsilateral start with ipsi. Ipsi is means same, so you can say think of itself, the same thing. Okay, so ipsilateral equal the same side of as itself. So if something happens on the right, the ipsilateral finding is also on the right side. That is very important. Okay, so let's say if something happened on the right side of the body, or maybe on the left side of the body, then in that case the ipsilateral finding will be also performed on the left or right according to the situation. If we are considering that everything is on the right side, so we will consider we will find the ipsilateral finding will be also performed on the right side. But if things are performed on the, if something happened to the left side, then in that case the ipsilateral finding is also on the left side. Okay, another trick is I, like here in ipsilateral we have I, so I stands for identical side. Okay, so this is one of the easiest way to remember it, because when you look at the word ipsilateral, it is started with letter I, and we all know that I stands for identical side. So whenever you want to understand this, so you can say that yes, I stands for identical, that means same side, that means it's a ipsilateral. Okay, so ipsilateral in the same place, same side. But when we will be talking about contralateral in the next session, then that time we will learn that it is crossed to the other side. Okay, it is not the same side, it is the other side. Okay, now you can imagine a person standing in the front of you, the right hand and the right foot, so both are on the same side, right hand and the right foot is equal to the ipsilateral, same side, both right. Okay, but when we talk about their right hand and left foot, or maybe left hand or right foot, they are contralateral because they are on the opposite side. Okay, so this thing you need to keep in mind. When both things are on the right side, you have to mention, or you have to consider it as a ipsilateral, and when both are on the opposite side of each other, then we will consider it as a contralateral opposite side. Okay, so I think till now everything is clear. What is ipsilateral, what is contralateral? Contralateral we will discuss also in upcoming session in detail, but at least you should know about ipsilateral so that you can compare it, because these are the pair terminology. So if you understand one properly, then another it's very easy to understand the another one, and that's why we are following the sequence. Clear? Fine. Now there is one question for today's session. Question is, what is deep anatomical term of direction? Okay, so I know you know the answer of this question, so please do share your expertise in the comment section so that others can take a reference from it. Also, when you write the answer in the comment section, it will indicate me that you are learning from these series, and according to that only I will publish the remaining sessions of medical coding. So as many time you answer the question, accordingly I will publish the remaining sessions. Clear? So yeah, I think now you can share the answer for this question, and in the next session we will discuss few more things. So thank you for watching TechShareMath.